The biggest part of the treatment process in the clinic generally is our third step. It's all about desensitizing the nervous system to the threat in the area of which you may feel pain. But of course the question is, how on earth do you do that? Well, when we have explained the process of how pain works, we recognize that as a response to threat, the nervous system can only do a few things. It can change the contraction of muscle tissue, and equally, it can change the secretion of hormones. Now, it's not very realistic that we test hormones because we have no ability to do blood tests on a second-to-second basis. But we can use manual muscle testing as a means of figuring out how does the nervous system perceive this area. And so if I have a hip problem, what we're going to do is we're going to test all the muscles that govern the hip. Now, we're not looking at strength. The best way to think of it is we're looking at your ability to connect with that muscle. And so when we test it, what we're actually testing is a reflex. Just like when you've previously had your reflexes tested, where you tap the tendon and you get a reflex response of the muscle. In this case, it's a slightly different reflex, in which where we apply pressure to the muscle, it should have an ability to kick back and you should be able to apply some force to match us. But in many cases, the nervous system will either switch that off and so the muscle will look weak, or it will increase the connection to that muscle and it will seem really tight and it will look super strong. But both are actually abnormal and dysfunctional. And so what we have to do is identify where is the information coming from that's causing the brain to create that abnormal response. And most of the time, this is because of heightened sensitivity in the nerve endings around the area. For example, if I have a sensitivity in the outside of my hip, it may well be in one of the tendons. And so what should normally happen is I should be able to stretch that tendon a little bit and nothing happens. If I was to repeatedly stretch that tendon over and over and over again, then eventually it will be normal for the muscles that govern that area to switch off in order to protect me. But if I've had some trauma, and if that trauma is healed, you may be left with some heightened sensitivity. So now, even the smallest bit of movement causes the muscles to change function. And therefore, your brain is getting information that there's a threat. And so by finding the source of the faulty information and resetting that, which we're going to talk about next, we're able to reduce the perception of threat in the area, which should then have a role to play in reducing the pain that you feel.